is first talk about our emergency food services. So I have some handouts. I had a dozen of them. I didn't know how many to make. But what the numbers show on that are, what I did is I went through our data for the last calendar year. How many Provo residents did we serve? How many Orem residents did we serve? And how many in Utah County outside of Provo, Orem, and Lehigh did we serve? And you'll see those numbers there. And you'll see the number says unduplicated, because the data we provide to the federal government has to just be, we count one person once. So if they come multiple times for food, that number's not reflected here. If they come for other services, that number's not reflected here. I just pulled out those who come for food services. So you'll see, who's here from Provo? Okay. Just so you know, Provo and the numbers I'm going to show you see a lot of people. More people than other areas, especially you'll see that when I show you the housing data. It's because we're located in Provo. You're going to see that specifically with the housing data. And so you'll see that those numbers there. One of the numbers I wanted to show you too is percent of families at or below 100% of the federal poverty level. That's a different measure than what you are measuring with low and moderate income, because your low and moderate income numbers are based on the area median income. And so that is a bit higher. The federal poverty level for a family of 4 is about $27,000 a year. That's the poverty level I'm talking about here when we measure that. That's a bit of a different number metric than what you're using here, but I wanted to show you so these folks are very poor. You can see on this paper as well that we have a variety. We have 4 pantries. We have 1 in Utah County, 1 in Wasatch County, and 2 in Summit County. And so the funding that we're requesting would go only for the Utah County pantry. And it would only go depending on who funds us, if we're chosen to be funded. We can, with our system that we have, our accounting system, we can say that money goes specifically to help those particular residents. But we also find that we're not the only ones who our pantry isn't the only location that can help people. We find that there are a lot of people who need assistance. So we partner with a variety of organizations. We provide food to the Utah Valley University's food pantry. We just started providing food to Timpanogos High School's food pantry. There's one at Landmark High School and one at Independence High School. And we're looking at partnering with the Alpine School District's interested in having us partner with them in some of the elementary schools. We also have a program called Backpacks for Kids, or Kids Nutrition Packs, and we send out about 1,700 of those a week. And those mainly go to Head Start organizations and to Title I elementary schools. In Orem, Sharon Elementary's one of the schools we go to. And I just remember that one because our food bank manager went to that one as an elementary when he was in elementary school, and so he just pointed that out, and that's what I remember that. But we also provide food for churches. We have a lot of smaller churches that provide small pantries for their congregants, and we provide food for those. We provide food for senior centers, and we also provide senior boxes. We also provide food for other nonprofits. For example, we provide food to Food and Care Coalition. We provide food to Encircle. Provide food to Family Support and Treatment Center. Anybody who might have a food or cooking component to their program, we provide food. We can provide food for them as well. So how much food comes through our pantry? About 3.5 million pounds a year. And we keep very close track of that. Our variance on our inventory, I have to brag because it was so good, it was 0.6%. We had it down to, we know where our green beans are. We know how many pounds. We had 60,000 pounds of green beans, and I could have brought you all a can of green beans, but that's not really what I'm supposed to do with our donations. So anyway, we have lots of green beans. Our food bank manager, Richard Manning, says we have a lot of garbanzo beans right now as well. So anyway, but we provide food to a variety of organizations. So that's the food pantry part. The money would go to help support and operate our food pantries and make sure that we're able to get that food to those who are in need. The application also includes a very small administrative cost as well to help cover some of those costs. Any questions on the food part?
Where is your pantry located in Utah County?
Our pantry is located down by the Provo Frontrunner Station, so 815 South Freedom Boulevard in Provo. And so we're located there.
Any other questions?
How many volunteers do you see?
I'm trying to, okay, I want to say that our number this year was around 8,000. I'd have to look, I just had a report due that asked that number, and thousands, I know it's thousands. And we have our volunteers come from a variety of sources. We have people walk in who want to volunteer. We have youth groups. We have Easter Seals who sends regular employees who come every day. We also get individuals who have been in the criminal justice system and they need to work community hours, and they come as well. So we have our volunteers come from a variety of places. All right, should I move on to the next? All right, so we have that food stabilization. We also have what are requesting monies to help with what's called housing support services. We have funds available to help people with emergency assistance. And as far as emergency housing assistance, we receive funds from FEMA. We receive funds from the Church of Jesus Christ of Latter-day Saints. We receive funds from the Department of Housing and Urban Development. The money that we're asking is to help fund case management positions, to help individuals find housing, or to help them connect with other resources that they may need. You'll see in the numbers here that Provo, it says number of unduplicated individuals served with housing. It's a higher number in Provo, and let me give you the reason why. Is because we serve a number of people who are experiencing homelessness. And since they're homeless, they don't have an address. So when we put them in the system, we have to put in our physical location address. So that's why they may have come from somewhere else, but they don't have that as their place of residence. And so you'll see that number here. You'll see in Orem there's a lower number, and then Utah County, excluding Provo, Orem, and Lehigh, but there's a higher number than in Orem. And you'll see again the percent of families that are below 100% of the federal poverty level. And you'll see that it runs between 81 and 90% of the individuals who are served here meet that. So what we like to do is we want to help people get emergency shelter and then help them find permanent housing. And that's one of the difficulties we're having right now in this community, in the area right now with the housing market the way it is. We currently have a position funded through the state where we have a landlord outreach specialist, and his job is to connect and establish relationships with landlords. And then we give that information to different organizations who have clients who are in need of housing. So we have my mind doesn't want to. Center for Women and Children in Crisis, for example. We partner with them. We partner with the different housing authorities who may have the really long waiting lists. And we have our own clients. And our clients face challenges, some of them, as they look for housing. They may be coming out of incarceration. Some landlords won't rent to people with criminal records. Some of them may have poor credit. They may not have enough money for housing deposit, which there is a program available in the community to help with that as well. So we're there to help them with employment, help them connect if they need mental health resources, if they need financial capability training. We have that in-house. You'll see that on our card. Our Financial Learning Center we help people with that as well. So it's another example of the types of programs that we have where we provide people with that emergency stabilization. And so those are the two programs that, besides Circles, that we're asking for funding. And so you have those programs, and then as they become more stable, we do, and they have money, like one of our former, recently retired housing counseling manager said, you've got to have money in order to budget. And so once they're kind of stable and have that job, and they're having their housing, we can help them with budget counseling and helping them get things in order there. We have what's called the Save Up Club. And the Save Up Club is an incentive program when people set money aside, or if they attend classes, they get a little bit of money. We received a donation to just cover that, and so they'll get a little bit more money. If they go and file their taxes with VITA, they'll get another little bit of money. And the goal is to have them have a $1,000 emergency fund. So we're working on doing that. So after they're stabilized, they're doing that, then they can be in part of circles, which you've heard about already. And then we also have down here at the end, we have homebuyer education. People who are ready to purchase homes. We have a 6-hour homebuyer education class, plus a 2-hour budget counseling session, and that's open for anybody in the community, regardless of income. My daughter and her husband, with my suggestion, just said, oh, my work has this great class. They took it, and they were very prepared to purchase a home. They knew exactly what they were getting into. Some housing loan products require that people go to this class as well. So we have that. The community action, we also have community gardens. We have a commercial kitchen. If you're familiar with chip cookies at all, chip cookies started in our commercial kitchen. So the reason I'm telling you all of this outside of our application is we're the whole puzzle at community action. We are the pieces. We work with other partners in the community who do things that we don't do. We want to work together and have to fulfill our mission, which is to foster self-reliance in individuals, families, and the community. So with that, any questions on what we do? We've been doing it for almost 53 years, by the way. So yes?
So it looks like a substantial amount of your funds come through the state.
Yes.
What is that acronym, TAN?
TANF, Temporary Assistance for Needy Families. So that funding source is targeted for households with children. So
that's on an appropriation, you've been getting that on a revolving year?
We have been, but it's, what's that?
Federal program going through the state.
Yeah, and it's a competitive process. In fact, the request for proposal just opened last week, and so we go in and we compete with other places in the state. But we enjoy something here in Utah County is all the organizations work together. We're getting together I think it's next week, to talk about who's doing what. Who's going to provide this service, who provides that service, so we're not duplicating and competing against each other for the funding. But we want to work together.
Is all your help in education and directing them in the right and connections and so forth, that's not into the actual housing, it's into steering them and guiding them and counseling?
The funding request, yes. The funding request is to help support the other programs that we have that actually provide the housing. We can use some of the money, some of that for the same types of things. It's just that some people are kind of a long haul in getting into the support services, and so we can only charge so much case management to a particular grant, for example. And so we need that extra money to help with that. So this money will not actually go pay for rents. This is to help provide the support as people are looking for and obtaining and remaining in housing.
Any further questions? Okay, we really appreciate you.
Well, thank you. I do not envy you. I do have some of these little tiny cards. I brought these as examples of what we have for clients or anyone else. We give them to police departments. We give them to other agencies that just spell out what we do. And you're welcome to take one of those as well. And holy smokes. Good. You can have a chance to have a break. Thank you.
A 1 through a 5. I mean, I can read that, and I think I understand that, I'd love some clarification. I mean, I feel one, it's meaning that they will continue to run without these funds, and they have in the past. This shows that they're not quite as needy on these funds, is that what that is telling me? I just want to interpret that correctly.
Yeah, it's that, and it's CDBG funds are ideally geared towards new programs or expansion of existing programs. It's not designed to be ongoing funding for the same program year after year. Ideally, these programs, they use CDBG funding to get started or to expand services and then sustain on other funds. So they score lower if it's something they come in for a year after year without an expansion or a new project. So that's another part of it.
I have a question on ranking or so forth. I like the dollar to go as far as it can, and on most of these, they don't have whether it's committed or matched or other contributions. So I'm a little bit lacking on saying if those don't come through, we're the only ones doing it, because that would change how I rank it, as if they have. And I also feel if others contribute, it's a better project because they've sold it on more people. On the uncommitted and committed funds, is that premature, or they should have? I mean, how does that mean anything?
It does vary from applicant to applicant. So for example, the Utah County Children's Justice Center, they receive grants year after year, but it goes in the uncommitted column if they haven't received like a confirmation funding letter from the organization, or they haven't received the money. So they don't get scored on those non-committed funds. Organizations score higher if the money is there in the bank where they have a commitment letter. So it might be a good question to ask the applicant if they anticipate actually receiving those non-committed funds, because it really, some people are going out for grants and they don't know if they're going to get it or not. They haven't received it in the past, or it's a new process for them. So it might be a helpful question.
So using that in my scoring is actually a valid point, whether they have other funds.
The only thing is, because I'm part of those kind of things, is on the opposite end too, because say you receive a grant from the Church of Jesus Christ of Latter-day Saints, there are almost like this organization too, is they're willing to fund you for like 3 to 5 years, but then they want you to find other sources. So you're actually asking a double-edged sword, is maybe if the church, that particular church is willing to give you money, they're gonna want you to go to other places too. So if you're saying, well, if they're not putting in the pot, I'm not going to. So they might have received funds from other places and now we're asking for funds someplace else. So you can't always go to the same source so if you're always looking, well, if they're not gonna put in, then I'm not gonna put in. Might not always be the also. Does that make sense? Because they might be going to you because they use their extension from others.
And I do with that with the total they want, what our percentage is.
Sorry. I didn't hear you. Me and my boss were supposed to
They
share.
are more than happy to go down because Bill
Okay.
Oh, so Stephanie works for United Way. She doesn't score on this project. I think usually you can sit in, but it's not a score.
Yeah, you just identify your conflict, but you can stay and you can actually score.
Welcome. Is this where the dance number starts, or? Yes. Amber, are you joining in the choir number, or the?
You just keep.
So yeah, I'd like to welcome you.
Well, thank you.
So this is United Way with Bill Hulterstrom and Shannon McCarty. Hi.
So please start out. You have 12 minutes to do your presentation. Well, you have 5 to 7 minutes to do your presentation. We now have another 6 for any of the committee to ask you questions and so forth. So welcome.
I know many of you here, so you may or may not be aware that United Way, of course, has been around since '63 in Tampa. Not that many years ago, we bought this beautiful lake. So we call this our community services building, and it's obviously where the food bank is housed. And it's for your nostalgia folks, it's the old Coca-Cola bottling facility. With that, it comes with some age problems, and I'll just show you few slides here to show you. Have you been to the building? So I can give you a really quick. We'll go quickly through it. Next slide. So obviously, there's stored lots of food in there. We also run all of our Angel Tree Supper Santa in that space. We also run other programs like our Welcome Baby program which goes out to first-time low-income mothers. We also run the paratransit program, which I think you're probably familiar with. And I was going to give you some orientation. So this is the top of the building. And there's two projects that are on this list that you can see right here. It's very helpful for Google to do this. You see a problem with that south roof? So see that right there? It leaks. And I'm told our tenants, Community Action Food, does not really, their folks don't like water dripping on the food. And warranty on that roof went out a few months ago, and so the big first priority project is that. Second part of the priority project, we'll show more pictures of. Go back one still, go back one. Move back up. Back to the map right here. As we got this new UTA partnership here, we have this fence here, which used to be in the middle of nowhere. We're very candidly, very discreetly, we're having more and more security issues there. More population of people wandering and drifting through, and so we actually want to, part of our project, because we have a lot of women that work in that office, we want to make sure that they have more security. So we don't think we should have holes in fences, and we'll show you some pictures of the fencing. So we have problems like this, we have holes in it over here. Just a few things like that that we think that we need to keep going. We also have we want to add more lighting where we have people who've been camping out. And we also have 1960 era windows that if we pull, a lot of this depends on pricing the bids, is trying to make it where it's less drafty. We also, because the space is getting more, this space is utilized by lots of community programs, as our list mentions. Including, we're actually slowly in some areas, actually you can hard cap some of the ceilings and add in storage is the cheapest way to add storage.
Yeah.
And so we're doing some of those things. So there's one more picture left. That was the last one, no. So really it's just designed to try to continue providing, it's kind of the hub of activities for a lot of the low-income services, and we're just trying to protect the asset and make that building not leak, more energy efficient and safer. It was kind of a summary. Was that within my time frame, Steve?
Thank you.
You know I like to talk on these. You know me. Questions for me? Not all at once. I'm thrilled with very few questions. It's my wife's birthday.
Well, I'll ask a question. It might save me from just locating it in this packet, but it's a big ask. It's the biggest one
Correct.
we've seen yet. So, can this project be completed with a portion of these?
So, that's a great question. We can't do all those things, so certainly if we had half that money, we'd be able to do the roof and maybe a couple small pieces. So we could do some of those things with less money. We were asked by the consortium group to try to say, if you can come up with, not come back every year, and that's why we put a larger dollar amount. But certainly, priority-wise, roof and safety are our top two things. And so if we don't get some of the energy efficiency we want this quick, we're in the business where we're used to asking. And we're also in the business where we don't always get what we want. Does that answer your question adequately? So we're going to do our best with whatever we can and do it wisely.
And Bill, maybe follow up on that. Are these prices backed by some quotes, or is this kind of an estimate?
So the prices were backed by quotes.
Okay.
The challenge though is with some of this, trying to find bidders for some of these is tougher.
Yep, for sure.
And the quotes, we started this process how many months ago? So depends how the building economy goes. Yeah.
Yep.
So the roof contract, for example, the roof one bid, we added I think 5 or 7% of the roof bid that was like 6 months ago.
Okay.
Just because we thought that was the prudent thing to do. But we designed the whole thing so if by chance we get that one cheaper, that means we can do more of the other things.
Well, just looking at your numbers as a contractor myself, these are really reasonable. So it looks like your subs are doing you well.
We do very well exploiting partners.
Yeah. Good for you.
Let me put it this way. Last time we did this 2 years ago with flooring, and we were told pretty much in no uncertain terms that they never want to give us a bid again.
Good.
Remember that? And don't even get me going on bathrooms, and Dan will tell you our dilemma on that thing. So our challenge is trying to get the right things where the right federal rules work into place.
Yep.
Because we've got a lot of good partners who will try to help us where we can. So we've got to partition the projects so that the federal rules don't encumber the volunteer spirit there. Other questions?
Well, I might ask the Mayor Frost question again. You do list the lowest grant required 207, so it does have to be in that range for you to.
So we
return the funds if we couldn't grant you that much.
No. We put the number, so I don't know how much of the history. We were asked for, and our last one, we were asked to go up higher. And so we went up higher, and then they said at that point, so we put that number in on that higher number. If it was lower than 207, we would still, if it was, I don't care.
That should break down like 87,000 for the roof. And
you can
45,
chose the
50,
pieces of what it would be like.
So you do
Yeah,
the.
we would do the pieces. We were just asked initially saying, well, we don't want you to come back that often. And so the more you give us, the less you'll see my face here. That's motivation for Stephen right there. No, but we always want to be good partners, obviously. We like the other partners who are part of it as well. But that's what we're looking at.
I like that you're fixing an older building and not asking to just rebuild.
So,
Sorry, but that's.
So, the sad part of this, there's not a real sizzle, ooh and ah through all of this. This is a very pragmatic, you go to the building, it's a very pragmatic building. We've done some things that still, we'll get like Jones printing glass up, which is colors that make it look nicer. But there's no question it's a very pragmatic warehouse building that we're just trying to stretch every inch of it and find more creative ways to do it. We don't put all the match part in because we try to keep it separate for all the federal stuff. But parts that aren't this project, of course, we have volunteers from BYU grounds who'll do stuff for us, and we'll do new sections here and there. So we try to leverage it. Anything else?
Yeah, it says, you have to do this in 18 months and you have some 2021 end dates.
That was the hardest question we had, was the time frame. So thanks for bringing that up, Mayor. I hate to look at Dan as I say this. Dan knows I'm the optimist of optimists that we want to be able to get done as fast as we can. There's no reason we can't move fast, other than trying to find contractors that are willing to play is the wrong word, utilize or follow the rules. Follow the rules of Davis-Bacon, etc. So we would, if we could find the right contractors, we'd get this thing done in 2 or 3 months. But we thought but history tells me that doesn't always happen. Sometimes contractors won't even return your emails because I don't want to touch that stuff. Mayor, does that answer your question?
Yeah, it does. So it's with what you can predict within your control.
Yeah. And we have a history of doing it well, and we have a history of being able to pull in different contractors, but it was still, I'm telling you, sometimes it's really hard. Right, Dan?
Yeah.
Anything else? Well, thank you for the invite, folks. Have a great day.
Tell your wife happy birthday.
Yeah, they're all waiting at 5:30 at the restaurant. You can check my calendar first. There's only 11 on the surprise party.
He's adorable.
Just the idea of why we were asking them to ask for more money.
Oh, sure.
Well, we're all looking at this number saying this is a really good
Yeah.
number, and we're asking them to ask for more.
Yeah.
Maybe explain that a little.
Yeah, so when we started this collaborative process, we wanted to focus on the capital projects because we were funding renovations, each giving small amounts, and those applicants would come back year after year doing renovations bit by bit, and it was turning out to be a really kind of wasteful use of funds. And so we wanted to come together, fund an organization completely for whatever renovations they needed, and then we don't want to see you for the next 5 years. So let's get together, pool our money, get the project done. And so we've asked, we had 2 applicants who came in for capital projects that are public service agencies. So United Way is one of them, and Wasatch Mental Health is the other one. We asked them to come for that amount because it sort of matched what each entitlement contributed last year to these types of projects, the capital projects from public service agencies. And so we didn't want to go too far above that, and we felt really good that we could accomplish 2 projects for the amount that we had done last year, and that was paid to everyone's committee. So 207,000 basically fits with them and our second applicant to meet that same number from last year for a capital project. Capital projects are obviously much more expensive to do, and like we said, we wanted to do it one time and get it done, and then not see them for the next year. So that's kind of why we encourage them to come for that high number.
No, great explanation. And so if I could, if it's fair to say, they are asking for a lot. It's your call as to how you want to recommend it. We feel like we can fund that. We have enough money brought in from all three partners for capital funding to fund that ask if it's your recommendations.
Yeah, when they originally submitted their application, it was for a bit higher, and we did recommend that they lower it just a little bit to make sure it fit within what we could each bring to the table.
So if we felt that they have several improvements they needed done, and if we felt some of them ranked higher and some ranked lower, you would prefer to do all of them to save on administration and do it once in 2 years? Is that what you're saying? To do half the high priority half a year and the other priority the next half?
It would be preferable to fund it now and have them coming in next year and do the whole process, not just from the application standpoint, but the actual finding the contractors and doing all that all over again. So yes, that the point that Jessica brought up was, let's do it now, let's do it once, and then it should be good for a little.
Or if the others rank priority, do none and do all of it in the previous year, not split it up.
And these are for public service organizations that are serving across entitlements. So as your individual commissions, you may see capital projects from public service organizations that only serve your entitlement area.
Yeah, but United Way and Wasatch Mental Health are the only two that apply that serve clients in all of our regions. So that's why they grab this.
Great. It just stretches the dollar too. I mean, you're trying to
For sure.
take 3 years to do one project.
Yep.
Yeah, if you're having to pull a contractor each year for one little thing, you're gonna, yeah, like you said, much work, less favorable pricing.
Yeah, and that's what we're trying to do is stretch the dollar further.
I think where this really stood out, I'm sorry, I'm taking a break.
No, please
This was the
do.
extra break. But we had the House of Hogue, who's actually being funded this year the same way. They came to Orem for a new stove, they came to Provo for, I think, kind of working on the bungalows, and then Utah County for something else. 3 applications, they were monitored 3 different times. We did all of this 3 times, and they still didn't really get what they want. I mean, they got pieces of it, but what they needed was much bigger than that. And last year, they were able to say, just bring us your wish list, let us pool our money, and we can get it all done in 1 year. And then you don't even come back for a long time. And it's really, really worked well for them and for us. I mean, especially when they're in the business of serving people, it's disruptive. Every time you've got to have a construction project going on, so just do it all at one time was frankly good for everybody. So that's the background of Jessica well said.
And then one thing, because my office is where I talked about, because of, it's interesting because just in the last year, because of Utah Transit, Central Spano used to be where our offices are now, and I employ all BYU EBU interns, young women, and I'm not in my office very often, but we have homeless people walking in our offices every single day. Like today, there was a fight outside our door. I happened to be there, I gotta go break it up. But the safety is, and I also help at the South Franklin Community Center where Boulders is, we never have the problems we do at Community Action. There's always somebody there that the safety is a real concern, like you wouldn't think of it is, but having my office there, it really does make a difference to know that my employees are safe and that people are.
So what exactly are the improvements that they're asking for to help that be more safe? Is it just
The fencing and then just better lighting, security cameras.
access systems, so maybe some kind of key entry?
Yeah, the key entry, but they're still having it available for public because we don't want to have to disrupt our day every time we go in and open a door for someone to come in that is there. So to be able to have just a safer system of that, it's very interesting, the clientele that just hang out there.
think we have our next applicant.
Good? All right, I'm up by Dan. Okay. So this is Brent Crane. He's with the Friends of the Coalition. He's our wonderful PowerPoint.
Welcome very much. We're gonna give you 12 minutes to explain, present your project, and 6 minutes to field questions from us, so.
Okay, so my name is Brent Crane. I'm the director of the Food and Care Coalition in Provo. The specific request we have to the collective this year, since there's 3 bodies, is $20,000 for our meal program. Our meal program, this is a picture of the building of our facility. For those of you, I know many of you have been down there, seen it, or been there, but some of you have not. So I'm not going to go through all these slides, but I wanted to at least give you a few visuals as we go through here. One of the most important things about this organization is that it's really the gateway for other services available to our homeless. So we built back in 2008, 2009, this facility, which is a collaborative model. As a nonprofit, we obviously had no interest in expanding our budget outside of reason, and we also wanted to make sure that we were collaborative in nature. I don't think you'll find another entity in the valley that has as many collaborative partners that are permanent on site or visiting partners to our facility. As you go throughout the facility, there's a few things regarding our mission that I think is unique. We always base it on research. Everything we did, including the construction of our building, was based on research. The nature of the project, when we originally went to Provo City for approvals, which is because where we reside geographically, we approached the city about what we needed to look like and what was best practice. And so research, practicality, and then balancing, the community's compassion with personal accountability. A lot of our programs require clients to contribute or engage or connect in some way. We feel that that is important. In fact, we just a couple weeks ago, myself and a couple of my board members met with the homeless czar from HUD, from HUD back east. And one of the things that they identified was that housing first is kind of the catchphrase now. It's the most important thing talked about in terms of new services that would be available to the community. He said that HUD failed miserably because they disconnected services from housing, and they essentially said we became a housing voucher program. And without support services, this population will often really struggle. And I think that's stating the obvious. So in terms of our program, our request is for our meal services there that I think is listed. This just kind of shows you some of the other support services they get while they're there. So a meal is really just an identifying mechanism for us. And then from there, we obviously engage them in services such as, clothing and hygiene, and if they're sleeping out, that they've got a warm sleeping bag and tarp and blankets and warm hats, gloves, that kind of thing. To, probably more important services such as, case management and housing. And I think we all know, I don't have to state the obvious, but our real bottleneck really in our county is affordable housing for our clients. We have 38 transitional housing rooms in our facility, of which our day service clients, the drop-in clients, access, as well as our residential clients that are kind of brought closer to the vest and engaged more with support services. So up here you have kind of the old model of doing, excuse me, maybe I got the prior one up there. There we go. So before we built this facility, everybody was kind of disjointed. We were siloed in terms of our services. And one of the purposes of this facility, even though we are not the only provider in Utah County for homeless services, we are the primary provider for homeless services in Utah County. And one of the things that we wanted to do was to kind of change that model. And so many clients would have to go to to DWS, and they'd have to go to the Social Security office, and they'd have to go to mental health, and they'd have to go down to community action or the domestic violence shelter, or any number of other services. And oftentimes we're filling out the same paperwork over and over and over again. And oftentimes you had agencies that competed in terms of what they wanted for their clients. So one's pulling in the path of, getting disability, and another one's pulling in the path of employment. And those are two divergent paths, obviously. And so what we've tried to do in our model is to try to bring as many resources to bear as possible. Does anybody have any specific questions at this point? I want to make sure, I'm not going to be able to go through all of the things here, but a couple of the partners that we have, I think this is important to indicate. We have 2 permanent partners in Wasatch Mental Health, which includes their WATCH program, which is their homeless outreach program, and also their jail transition program, along with Mountainlands, which provides medical and dental services. Which have substantially improved over a private provider that we had up until last year. In fact, they're going to be remodeling the clinic here shortly. But then we've got an additional 12 to 15 community service partners. We have the VA services that checks in twice a month at our facility to do outreach. We've got DWS doing outreach for mainstream resources. We've got private individuals teaching classes or doing yoga classes or any number of things, all to provide additional connector points for our clients, which we feel is absolutely vital to this client's success. So with that, I don't think I'm going to go any more into it. I'll just let those naturally play. You can look at them and then I'll just answer your
What
questions.
is your relationship to community action services? I know that you're geographically pretty close and that you serve a lot of the same people.
So we often get confused with community action. The public oftentimes confuses us, but there are some really important distinctions. One, community action is primarily a federally funded, state-funded entity. They get 90% of their funding from federal sources. We're just the opposite. Almost all of our funding comes from private sources. That's one distinction in terms of funding. In terms of clientele, they provide a food bank, which necessitates that you have a vehicle and a home to go back to. So they serve more the low-income community. They do reverse mortgage counseling for seniors. They do have the Circles initiative for family. Really the only thing that we could construe as duplication is that they have a voucher program that we used to both do, and we both basically signed an MOU that we would no longer do that. We were going to focus on the housing on site. So there really is no duplication of services, but we work very closely together. Karen is a wonderful individual, and I think it's been a joy to work with.
So you're working more in the homeless, like
Homeless,
critically
homeless,
owned,
absolutely.
and she's more in the very low income.
Yes,
Cool.
correct. That's a good distinction.
I've lived in Provo for 20 years and just now understood that distinction.
I've got a question. It's probably as much curiosity as anything, but that is a substantial food come up from your community, a dollar figure of $475,000. Is that an annual thing?
That's pretty consistent. You got some that will fall off and some that will come on board. And we're not when you think of the U of U versus BYU or the Postal Carrier Drive or the big Scouting for Food Drive, that all goes to community action. And that replenishes those food shelves that are going out into the low-income community. Ours primarily comes from private drives, catering companies, individuals. During harvest season, a lot of harvested garden supplies, fruits, vegetables, that kind of thing. So.
That's pretty good. Thank you.
And we even have a few restaurants that give us a day off, typically on a holiday. So we have McAbee's Restaurant that does our Christmas Eve dinner for us, regardless of when Christmas Eve falls. We have Sweet Island Grill that does Christmas Day. And then we have Marvelous Catering that does Thanksgiving for us.
Wow, that's so cool.
And they come to you, right?
They come to us. Now, those situations, those 3 situations, oh, and I forgot Elks Lodge does one also right before Thanksgiving. Otherwise, they're on site. The rest of those, they actually go on site. Marvelous used to do it on site, but they just with Molly's. It's right by their catering services, so they just have started doing it there instead.
But they bus the people there, right?
Yes, we either bus it or have sign-up lists where people just gravitate there. We let them know well in advance that that particular meal is going to be held at a different location.
Is your volunteer, like, for people to come in and volunteer to help serve and stuff, is that still like 6 months out?
Yeah, in fact, we actually created a new policy. We now only book out 3 months in advance. So to try to avoid that problem, to give more people the opportunity, but about 15,000, about 7,500 unduplicated volunteers contribute at our facility each year in various activities. Some of those were posted there. And then, but about 15,000 of those hours are just in the meal program alone. That's picking up food donations in the community, that's hauling stuff to the food bank or hauling stuff back to the food bank with community action. We share food pretty regularly. And then just preparation, serving, cleanup after meal times, that kind of thing. And I extend the offer as I always do. If any of you want to come for a personal visit, I'll give you a full tour of the facility. And we're really excited. We lost a really large pledge towards our permanent supportive housing project last summer. We were anxious to break ground on that project. We're looking to add 72 new one-bedroom apartments. These will all be permanent supportive housing. In addition, we're building another 5,500 square feet of office space to accommodate Wasatch Mental Health's growing partnership on site. Now with their combining with Utah County substance abuse services will be available on site that were not prior. And then Fresh Start, which is a jail outreach program, will be on site. And we're always looking for like-minded partners that have added value for our clients. Any other question?
Okay, thank you very much.
Yeah, you're welcome.
Enjoyed your presentation.
Thank you. Done? I'm out of here. You guys get bigger. You want me to just do that here?
Whoa, we're running early. This is cool.
So we can have a long dinner break if you'd like, and it's got dinner description. And if you are ready to send your score sheets and save your speeds, feel free to do so.
Oh, no, you can do it.
I can really move them over. No, don't move them over. It would really be bad. I think I want to see it for one weekend, and I'm so sick. It's probably my
I don't know. Mostly because I wanted to know. Yeah.
We're just going to get their own more support. They wouldn't end up.
There's a variety.
Thank you.
I'm not used to chairs with wheels, so I'm having a hard time containing
You are
myself.
fine. I don't mind at all.
Okay. I just feel like I'm like growing in my space here.
Yes, we're ready.
Okay, thank you. Okay, this is Rachel from Community Health.
How are you? Very well.
Just
use that?
Oh,
Oh,
that's
there you go.
okay. Should work around.
Okay.
Perfect.
So we'd like to welcome you before.
This is Rachel Lovejoy, Community Health Clinic.
Yeah, it's good to meet you.
You too.
We're glad to have you here. We're giving you 12 minutes to do your presentation and tell us what you're about.
Okay.
And we allow about 6 more minutes for us to
Ask questions.
ask questions and do that, so.
Okay,
Go
sounds
ahead,
good.
time's yours.
6-minute presentation, 12 minutes total. Just
Oh.
so you
No,
don't.
I'm just kidding.
I don't want to put you accidentally get
I'll just write that.
6-minute presentation.
12 minutes total, that's, I got it.
Okay, you're totally fine, no worries. All right, I feel like a lot of you know what Community Health Clinic does. I see a lot of you every year you come and you visit in our office, but for those who aren't aware, this is actually a good reminder for our patients that we are not an insurance agency. We do not pay the doctors that our patients go to, but we are a nonprofit. We cover all of Utah County and we coordinate charity, medical, and dental care for low income and uninsured residents of the county. So we have a network of about 200 specialists who donate appointments through our program. And that looks different for every doctor. It really depends on the provider. For Revere Health, for example, we've been integrated into their onboarding system. And so with every new specialist who comes through Revere Health, they're told, this is how we give back to the community. Financially, we give back through United Way, but if you want to give back in kind, we donate appointments through Community Health Connect. And so most of our doctors donate 1 new patient per month. Some of them do 1 patient through completion. It really just depends on the type of specialty. This is a super wordy slide, and so we're just going to concentrate on the really brief underlined parts, that statement of need, right? 21% of Utah residents living in poverty lack health insurance. 25% of Americans don't have dental insurance. And then this is always the one that blows me away, and we spend a lot of time on programs that deal with this, but dental caries are the #1 health problem faced by Utah County school children. That's the #1 thing that's keeping kids out of school. And so we have a lot of different programs that really focus on that. The most recent was on Saturday at the Utah College of Dental Hygiene here in Orem. We did Give Kids a Smile. And so we had 22 dentists who came in. All 60 of the graduating dental hygiene students were there. We treated 110 kids. And so we did all of the preventative care, but then also the restorative care. So fillings, extractions, crowns. And there were probably 25 kids who they couldn't do all of the work that needed to be done. I talked to one kid who was 10. This was his first dental experience. And so he had decay in all 4 quadrants. And so we couldn't do all of his work that day. But so there definitely is a need, right? Even with the expansion of Medicaid, even with the Affordable Care Act, there's definitely a need for this charitable care. And so like I said, we work with the Volunteer Provider Network to connect patients to these doctors who are willing to participate. And like our name states, through Community Health Clinic, improving the health of an individual becomes the effort of a community. We work with the school districts and the social workers and the school nurses there. We work with the hospital systems. We work with other community health centers and free clinics to try to address the healthcare issues in the community. So, the way that our program works, we have to have a referral from a primary care provider. That's super important. Otherwise, I would be flooded with patients who said things like, I need to see a neurologist. Please get me into a neurologist immediately because I have headaches. And so we work really closely with these primary care providers to give us accurate referrals, and then to get these patients back into a medical home. We're not just going to put out that fire. We want to get them back to their medical home. So we work with Mountainlands Community Health Center, the Volunteer Care Clinic, Gatmeyer, Dixon, the East Bay Clinic with Mountainlands. The patients who qualify for our program must fall at 150% of poverty. And they have to prove that to us through a month of pay stubs, 3 months of bank statements, and taxes, or a letter of support. And depending on what care they need, sometimes they need all 3 of those things. If we're going to send them to the hospital for some care, we need extra documentation. They have to live in Utah County, and then a $20 fee. there are some of the specialists, the specialties that we coordinate. But just to get through to our two other big programs, we've got our dental program manager, like I said, with dental disease, with caries being the #1 reason that kids are missing school. This is a super important role in our office. We just did the Utah County Give Kids a Smile event, but also what starts tomorrow is we go to all the Title I elementary schools in Utah County, 1 school a day for the next couple of months, and we apply fluoride varnish. We work with the MTech dental assisting students, apply fluoride varnish to these kids' teeth. And what we're doing is we're looking for kids who have really, really bad decay. Decay is so bad that I could take any one of you with me and you would look in and say, oh my goodness, this kid has a problem. And we find a handful of those kids at every school every year, even though we're going twice a year. And we then are able to connect those kids. We call the parents that day and we say, look, this is what we found out. Try to figure out, do they qualify for Medicaid? Do they have Medicaid? Do they know how to use Medicaid? And if the answer is no to all of those questions, then we can connect them to the free resources that we've got. And our health access assister. So currently, every patient who walks through our doors is being screened for Medicaid eligibility. We want to make sure that our limited resources are being used for those who don't qualify for Medicaid. And we have found a lot of patients who qualify for Medicaid who either didn't know that they qualified for Medicaid, or the Medicaid application process was so difficult that they just gave up. They got denied, and they got denied because they didn't sign one piece of paper or something. It wasn't because they weren't eligible, but they got denied and so they gave up. And so that's what Sheila does. She not only screens them, but then she also helps them fill out their application and then babysits that application all the way through. So this is our last slide for 2019. We coordinated care for 595 individual patients, over 1,800 appointments, and then over $1 million of donated care was given by our specialists. So that was probably more than 6 minutes, but I couldn't talk any faster than that. So what questions do you have for me, if any?
So if your funds are, here are mostly for personnel, that meaning you're taking your clients or whatever and then aligning them up, it's not providing the care because the care is donated.
Exactly.
It's matching them up and with the need and with the resource.
Yeah, so what's interesting about our program is we're not paying the doctor directly, but what that does mean is that for every $1 that's donated to our program, that results in $6 in donated care. And so we're able to stretch that $5,000, $10,000 times 6 because we work with that in-kind donation from those providers. So, yeah.
So, this is only, they have to be a US citizen, right?
No, they do not.
So, for anyone?
Yeah, for this program. For other funding, there's a restriction on that, but not for all of our funding. And that kind of is part of that gap, right? That Medicaid gap.
You serve mostly kids, or that's just part of your program?
No, we actually, the majority of who we serve as adults, most kids, we should be able to get qualified for Medicaid, especially if they were born here in the United States, even if there's a mixed legal status of the family. So, but with our kids dental program, obviously we do see a lot of kids, but that's just with dental. Our medical program is actually significantly larger.
So then part of that funding goes towards helping these families get the Medicaid they need?
So this funding we have earmarked for the Volunteer Provider Network, and so it's for those who don't qualify for Medicaid. So we have different funding that comes from Utah Health Policy Project that is just for helping those families get Medicaid. Any other questions? Those are easy questions, guys. I came prepared for all sorts of things. Okay, perfect. Thank you so much.
Actually, I do have, so with this funding, will this enable you just for one more year, or will this promote, let's get this going so there's a benefit more than this year?
It's
I
a
mean,
good
I
point.
know in the lives of the people you help, it'll.
Right,
for a long
it's
time.
a long-term
But as
decision.
far as your organization, next year, will you is this sustainable or is that?
Right, that's a great question. So, the way we try to structure our funding is such that if we were to lose a funding source like community development block grant funding, we would be able to carry on. We've got matching funds, we're always looking for other sources of funding. This is a project that has been going on since the late 90s, since 1998. And new funding needs to be found each year, right? State primary care grant funding went away a couple of years ago, and that was a $20,000 loss in funding. And so if this funding were to go away, yeah, we'd find new funding. The program, however, would also still go on. I don't know if that answered your question. Okay, thank you so much.
Please.
Maybe just as a point of clarification, CDBG funding does not have a residency requirement, so we don't have, you know, if they're serving a non-resident or non-documented resident, that does not matter. We do not have to track that using CDBG money.
So to qualify that answer, for these type of services, it is
Right.
not.
Right,
Yeah.
right.
Are we ready for this? Hey guys, from the Center for Communicative Disorders, we have Linda, Sasha, and Victor.
Okay, welcome. Good. Glad to have you here.
Thanks for having us.
So we give you 12 minutes, 6 minutes to give your presentation and tell us what you're after, and then 6 minutes to field questions.
Linda Spencer is our head of our MSSLP program at Rocky Mountain University of Health Professions. And Sasha is our clinical coordinator for the Center for Communication Disorders. I'm the director of the foundation for Rocky Mountain University, which we kind of oversee clinically. So we're just going to kind of use that. One real brief explanation. Our pre-application was for a capital grant. We were looking at doing a radiology lab, and we couldn't really put everything together that we needed to in that time. And so I asked the executive directors if we could just submit a program grant for something that would be very, very needed and useful in the community. And so a grant is kind of shifted to that application. So if you look at it, you'll see some differences there from the pre-app to that.
Yeah.
That's
Oh, sorry.
that's my neighbor. I actually referred him to your program. It's great. He's enjoying it.
What we wanted to do, first of all, is just share, if it'll come alive, a brief video that really will explain more in depth what the CCD is, and give you a little better basic
You can do,
understanding.
it's a touch screen if you have to.
While starting that, I just want to point out, because I mean, this pre-application, this is a tiny bit, it's going to be different from the body, but the information you need is in the full application.
All right.
Yeah, we could do that as well.
YouTube.
Here it is. Now you might have to combine those P to, yeah. Thank you so much.
Welcome to the Center for Communication Disorders here at Rocky Mountain University Health Professions. I'm Wendy Chase. I'm the Director of Clinical Education. I'd like to invite you to see some of the things that are happening here in our clinic. We strive for exemplary patient care and high-quality clinical education. Here in Utah, particularly in Utah County, we have a very large pediatric population. There are not enough services to meet the needs of all of the children who have those needs.
We've been trying to find a speech therapist in Utah that was familiar with the device. My son was using as his augmentative device, and we've had a really hard time finding someone that was familiar with it because it's not the go-to device for Utah in the special education segment.
The graduate students here in our clinic have great opportunities to hone their clinical skills here with supervision in the clinic in order to be able to provide a service that's very comprehensive and very individualized to the needs of the families that we're working with.
What makes Rocky Mountain University stand out over other places, I feel, is I actually love that it's a university, and I actually love that it's a student with Rome, because they are so invested. This is their degree. So I feel that they put a lot more time and effort into Rome as an individual.
Yeah, we spend a lot of time working together in small groups or all together, learning from each other.
And yes, I have my supervisors and they'll help me along the way, but they let me explore. They let me try things my own way. Maybe things that they haven't thought of or things that I need to learn from my own experience.
When we think about people who have had strokes, we usually think about the older population, those who have more access to third-party payers, but there is a substantial number in our community who have had head injuries from snowboarding accidents or have had stroke secondary to cardiovascular disease that has resulted in a communication or a cognitive or a language impairment of some sort. Many of them are uninsured or underinsured or have to go through the struggles of fighting a third-party payer to get the services that they need to be able to communicate with their mother, with their father, with their daughter.
My family, I want to talk so that they can hear me.
If anyone is interested in Rocky Mountain, I would highly suggest it. I mean, it's somewhat rare these days to get something that's of quality, let alone for free or at a low cost. And usually if you do that, it's through kind of maybe a government-sponsored program. You almost feel like you don't want to do that because there's so much work behind it, where here it's been super easy.
Using state-of-the-art equipment while actively learning evidence-based clinical care practices, students begin changing lives just weeks after school begins by working in Rocky Mountain University's speech clinic. By doing so, the Center for Communication Disorders actively accomplishes Rocky Mountain University of Health Professions' core value of service. Whether you're a prospective student or a potential patient, call us at Rocky Mountain University and see for yourself how we significantly improve the quality of life for the most vulnerable children and adults in our community each day.
That's the only trick I know. Is Windows P and duplicate. Yeah. That looks like we're getting 2 slides up there.
Let's see. It should be now. Let's see. You will need Steve.
Yes.
Help us out. Is it the extender?
Usually it's the duplicate.
That should be it, right?
Oh, Dennis is doing the whole.
It was working fine before.
We could go backwards, maybe.
Backwards.
Like, this way? As it is all kind
Oh.
Sorry, guys. Computer.
Speech pathologists are especially qualified to work on feeding and swallowing because we have so many classes and courses in anatomy and physiology of the tongue, the lips, the swallowing mechanism. And so if you look at this slide, you can see food comes into the mouth, then hopefully it goes into the esophagus and not so we want it to go this way in the back path in the esophagus and not in the windpipe or the trachea, because that's a direct line into the lungs. So what we do is we target what we call the oral phase and the pharyngeal, or the phase just after the back of the tongue, to make sure that when people are chewing and swallowing that they have protection of their airway. And we can do the next one. We have several roles in this, and one of our roles is to complete an instrumental screening, which is, as Vic was telling you, our original application was for a grant for some capital equipment that helps us do like a video motion picture swallow. It's an x-ray, but it's a movie x-ray, so you can follow the food down. However, there is a lot that we can do in the oral phase to screen for those individuals who do have dysphagia and swallowing disorders. So we can complete that oral phase screening, and then we can help provide training that will reduce the risk of aspiration or having food go into the windpipe. We can look at how a person is manipulating the food in their mouth, if they're able to control that bolus and get it in a ball. When you swallow, you get your food into a ball, so it's organized so you swallow it in one piece, not piecemeal. You've all probably had that experience where you're not paying attention or you're laughing, somebody tells a joke and you're drinking when they tell the joke and you choke. And what happens in that situation is your vocal folds are coming together as a protective mechanism to stop the food from going into the airway. And so most of us are safe even if we choke. That horrible coughing that we do is expelling air and pushing the food up above the vocal folds and back into the mouth. So we realize that there's still enough we can do without the equipment, the video fluoroscopy, such as recommending texture changes, diet changes, diet consistency changes, and those types of suggestions that can actually keep people out of the hospital and decrease their risk for aspiration and getting pneumonia. So we can prescribe those exercises. So our proposal is to, you can turn it, is to do these what we call bedside or non-instrumental screening strategies with children and adults. They're our most vulnerable patients. Children are vulnerable, of course, because they have smaller airways and they are more susceptible to respiratory issues, and older adults and the aged are more vulnerable again because their airways and their respiratory systems are more impacted. So we are asking for monies to do these screenings at the South Franklin Community Center. That would be one catchment area. We see both children and adults there. And then to seniors in the southern part of Utah, throughout senior centers in those areas. We estimate that there are over 24,000 individuals that are older in Utah County that suffer from feeding and swallowing disorders. What happens to many of these people is they stop eating or they avoid eating, they don't get enough calories, they lose weight, and they become medically compromised. What happens with children, and we estimate there are 588 children in the community that have feeding issues, swallowing issues. It's the same thing. These children won't eat what they need to eat. Their nutritional status becomes compromised and they become ill and they lose weight. So through this screening project, we hope to identify those individuals at risk, refer them. We can do some instrumental testing at our clinic, and what we can't do, we would refer on to physicians. Thank you.
Any questions? What was your service area? You said.
The service area?
Yeah, I think it's southern Utah or.
Southern
the
Utah
service area,
County.
the service area is Utah County.
Yeah.
For the Center for Communication Disorders.
Yeah. And
But southern Utah County for the seniors, we want to go down to the seniors in that area because it's a little harder for them to get to primary centers where they can get that kind of thing.
And the South Franklin Community Center is in Provo, and that serves a lot of lower income individuals. We do some reading projects there and some outreach to older people there as it is. We have a little bit of contact there.
Since this is free care, we primarily focus on the underserved.
Is this your first time making application?
Second time we did it originally for Utah County. We had a grant for when we first started the clinic.
Yeah, it's when I saw it and I texted Mike and said, hey, you gotta get into this, and so he did.
Yeah.
I really did for him.
And this is the first time for everybody for this group, so.
Okay, thank you very much.
Thank you.
Appreciate you coming in, go through your presentation.
Thank you. Thanks for your
Housing, one of these really
Jordan, she's
no,
been very
really
brothers
important.
and sisters.
Yeah, it just, how you have to fill.
Yeah.
Welcome up very much, Jordan. Appreciate you coming here. We give you 12 minutes, we give you 6 minutes to give your presentation and tell us about your project, and now another 6 minutes for fill any questions and answer.
Sorry.
Boys and Girls Club is next, so we'll be sure to thoroughly confuse you between the two of us. All right, so I was just going to give a little background about what we do specifically in case you're not aware of what our program is. Big Brothers Big Sisters is a national affiliation. We have about 270 agencies across the country, so we're one of those serving the state of Utah. And like most national affiliations, each agency runs as a separate nonprofit, but agrees to use the mentoring model and adhere to their standards of practice. So here's our mission. And we have been around in the U.S. for more than 100 years, and we've been in Utah for 42 now. So throughout that time, Big Brothers Big Sisters has researched a mentoring model and the positive outcomes that it can provide for kids. So we know that kids who have many risk factors in their lives are more likely to succeed if they have some additional protective factors. So having a mentor for at least 12 months can help combat some of those risks. Kids who have a mentor for a year or more are likely to have better relationships, do better in school, and avoid risky behaviors. So here's one of our matches. The kids that we serve come in all shapes and sizes and ages. The average age is 12, so kind of in that middle school, like having a tough time age. But we do enroll kids as young as 6, and we'll match them up until they're 17 to give them someone. They're coming to us looking for a big brother or big sister to have fun, spend time with, talk to, and eventually help them reach that potential. So the demographics, you can see here, we served 51 kids in Utah County last year. The kids we serve have multiple risk factors in their lives. Some are maybe from a refugee background, living with one parent, maybe have a parent who's incarcerated, or they may be in the foster care system. Others may be affected by opioid use or other addictions, struggling at school, being bullied. So we currently have 12 kids right now who are on our waiting list from Utah County who are waiting to be matched with a mentor. And 2/3 of our waiting list statewide are boys. We do get more of them applying, and then also fewer men volunteering. So there's always a need for that. Here's one of our other matches. And so we make matches really carefully based on the preferences that kids and volunteers give us. So we also do really extensive background checks and references on volunteers. And the volunteers and families both go through extensive interview process as well. So once the match is made, we are calling the volunteer, the child, and the parent or guardians each month for the first year. So that's a lot of staff time going to that support. And then we do that quarterly thereafter for the rest of the match. Our match support specialists are trained in youth development and child protection, and they are really there to answer questions or concerns from mentors or families. And so our staff, in addition to providing that support, they are also giving ongoing training opportunities for bigs and parents to address things that are going on in their communities so that they will be prepared to discuss with their littles. We do things like trauma-informed care, suicide prevention, internet safety, things like that. And then we also provide activity ideas for matches and tickets through an app that we've developed that allows bigs to search, register for, and track all of their one-to-one outings with their little. And then finally, our staff can provide referrals if the family of our littles are struggling or maybe need additional social services. So our outcomes, we assess those using an evidence-based pre-test, post-test survey. So we're looking at 7 areas of youth development. We assess where they are before they've met their mentor, and then each year after that when they're together. We look at whether or not they've improved or at least maintained the baseline level in each of these areas. So typically as children age, their self-assessment shows decline, like maybe they're less confident or more likely to engage in risky behaviors. But with the support of a mentor and our staff, they are able to maintain or improve in most areas. So the program we're doing here in Utah County is our kind of standard program model that you're probably most familiar with, which is community-based. So the goal of our mentoring matches is to be together at least 12 months. That's going to provide the best outcomes. And so on average, volunteers spend at least 6 hours monthly with their littles, probably bi-weekly, but they can set that up however they want. The matches share everyday activities like eating out, going to movies, playing basketball, whatever they might want to do. But it's just the fact that someone is there for the kid that's most important. And so here's some of our matches doing the activities that you can do in community-based. You see there's working on a car, fishing, skiing maybe. And so really the big just takes the little on something that maybe they would already be doing and exposes them to something that they would not otherwise have the opportunity to do. And so the use of CDBG funds for us is definitely going to be to increase the number of kids that we can serve here. We haven't really been able to focus as much down here in the past, and I mean we were still able to serve 51 kids last year, but most of those kids came through word of mouth or counselor referrals, and we really want to be able to use the money to focus on reaching out to kids who maybe don't know about our program, who would need a mentor. In order to do that, we also need more volunteers, so we also have to work on reaching out for recruitment purposes. And one way that we would do that is by partnering with local companies, organizations down here. We do have some, I think, listed in our application, but the funding would allow us to recruit more volunteers, building strong relationships in the community, and getting some of the kids here off the wait list. What questions can I answer?
What medium do you use to recruit volunteers and put the word out for the who need services? What medium or how do you do that? I've heard of your name before, but I haven't heard of your services before.
Yeah, so we have, for the kids specifically, I mean, a lot of it is word of mouth, so the more kids you can get, and then their families say, oh, my kid was involved in this, and it kind of spreads that way. And then, just having partnerships with organizations like maybe United Way, I mean, we work with them a lot. Any other social service organization that's making referrals to the people they serve, we want to make sure that they know about us and that they're able to refer, and likewise us to them as well. And probably a bigger presence going out to some of the schools here, which we haven't been able to do before. We go and do some presentations in the Salt Lake area at schools, but to be able to come down here would be great. For volunteers, it is a lot of reaching out to companies to post maybe in their newsletters or whatever they might have to their employees, like, hey, this is an opportunity. We're trying to grow our marketing in general as well, so that would be something of whether we might push out ads, social media marketing, things like that.
Does BYU have a Big Brothers Big Sisters?
Does what?
Does BYU,
we use
BYU match?
Yeah, we have, I don't know if they have an actual program there, but we do match a lot of students with littles, yeah.
How long is the match? Then you said at least 12 months, but it can go up to like years?
Yeah, if we match a kid when they're 6, like we just had girl graduate from high school last year, and she had been with her big since she was 6 years old. So it can last that whole time. Sometimes they choose to end before that and still maintain that relationship, but then they can go on and do other things that maybe are limited in our program. But yeah, we want at least 12 months so that they can establish that relationship and get some good outcomes.
Any more questions? Okay, so your goal is you're doing 51, you want to increase that for 70. This additional money will fund the personal benefits, wages to help in the matching process.
Right.
The recipient, don't put anything in it, and the big brother, big sister, they're all volunteer work.
Yeah.
This is just the matching and the
That support
advertising
every
getting out.
month.
Which is personal.
Yeah.
More call for any questions? Okay, thank you.
Thank you.
Jessica, can I ask you a quick question about the scoring sheet? So I noticed some of the organizational capacity, they scored a 2 according to you guys. What does that really mean?
Do you know who did that?
I did.
Sorry, what? I didn't hear the question.
You did the Big Brothers Big Sisters site
Yeah, what was the
visit.
question?
What their organizational capacity score
Yeah,
to was
it's
that?
scored as a 2, which is your lowest one here. What does that mean?
Sorry. Oh, it's just because we haven't worked with them. Last time that they received a grant from Provo was over 6-8 years ago. I wasn't in charge, so I have no
Oh, okay,
basis
so this
to-
is nothing to do, because I was like, that was a beautiful presentation, and I
Yeah,
know their
it's
program, why
nothing
did they
based
score
on
a
the
2?
organization itself, we just don't know.
We don't know.
Okay,
We haven't had that interaction.
but if they scored like a 4, that means they did they were a little bit more difficult to work with, or? I guess I'm just having a
Yeah.
hard time understanding how that number.
How that point, how
Well,
those
like
points came,
circles, yeah, circles scored as a 4, does that mean that they weren't really super easy to work with, or you don't
But they
trust?
were.
They
So
were.
the higher the points, the easier, the better it is to deal with them. And so a 4 is close to
good.
almost a 5, and
Okay, I just wanna make
the
sure.
2 there was,
First time.
yes,
Got it.
so.
Man, these scales are hard.
So it's
We didn't
based
move
off-
on because it wasn't the first
Multiple
time, but
Based
it's
off
been
our
long
experience
enough
working.
that we don't know.
Those should be separated. Okay, cool, thank
Do
you.
you have something to put on that? Glad to hear it. Let me change that. Who's gonna?
Boys and Girls Club? I don't think I have one. Yeah. All right, and the Boys and Girls Club, Jenny and Shannon.
Thank you very much for coming. Appreciate you being here. We give you 12 minutes, we give you 6 or so minutes to do your presentation, and then the remaining 6 or so minutes to answer any questions.
Sounds good, well, thank you for having us. I'm Jenny, and this is Shannon, we're with the Boys and Girls Club. We wanted to start by just kind of introducing what we do at the Boys and Girls Club. We brought our most recent annual report for the couple of hours to take with you. Our mission is to inspire and enable all young people, especially those who need us most, to reach their full potential as productive, caring, and responsible citizens and leaders. Currently, we serve about 5,600 youth in grades K through 12 in both out-of-school and summer programs. We provide a safe place for kids to participate in a wide range of activities, including academic programs, experiential learning, STEM activities, enrichment, and physical education. Most of the kids attending our programs come from low-income homes, and their parents are working, so they don't have a place to be during those after-school hours. The services we provide are designed to enhance the social, educational, character, and leadership development of our club members. We're requesting CDBG funds to be used to improve our reading and math proficiency of about 125 low-income Provo, Orem, and Utah County youth. We've done a comprehensive needs assessment and provided review for principals, teachers, staff, and community members to kind of evaluate where the greatest need is for our services. From that assessment, 93% of teachers reported that math is a significant need, and 90% reported reading support as a high priority. Of the total respondents, 96% identified math and language arts as a significant challenge for youth in our community. Within the targeted students who we'd be serving, only 31% of them are proficient in language arts and 33% in mathematics. And kind of on average, the free and reduced lunch rate of the sites we'd be serving is about 61%, but it goes all the way up to 90% in one of our sites. After-school programs are an ideal place to meet these needs and address these issues. The University of California at Irvine led a study that concluded that after-school programs lead to improved academic engagement. And similar studies have duplicated those findings that after-school programs close the achievement gap and have a positive impact on reading and math achievement. And I now want to shift over to Shani. She's going to talk about the programs we're running specifically for both math and reading that are designed to help kids improve their math reading scores.
I get to talk about the fun stuff. So the Boys and Girls Club, we take about 45 minutes every day to focus on academic enrichment for these kids. And they get this on a daily basis. And the focus this year especially has been reading, especially the reading. And then we've done some math things as well. But before we start the program, we go into these schools and we meet with the principals and we talk to them about what are your highest priorities. And across the board, we've got to get these kids better at math and reading well. That's what every principal tells us. And so that is something that we focus on. For the 2019-2020 school year, the focus during homework help time was to increase reading proficiency by piloting a new reading program. We used the National Right to Read Foundation's reading competency test to determine what reading level the children were at. And we found that most of the kids were about 2 levels behind their grade level. This was consistent with what the principals were reporting to us as they had done their assessment as well. And so we recognized this, and so we came up with a plan, and we found a program that we were happy with and excited about. And so during homework help time, we spend that time doing the Scholastic Guided Reading Program. So I brought an example that you can pass around. Just pass them. There's a couple different ones. There's 6 different stories. And while you're passing that around, I'll explain what it is. But the Scholastic Guided Reading Program, these are cards, and they are provided for each site and consist of short nonfiction reads that cover all the elementary school reading levels. So they have them from A to Z is the way they define them. The cards come with booklets and with each reading level that look like this, so that a facilitator can follow along with the child. And there's vocabulary questions in here, and there's comprehension questions in here, and ways to be able to determine their proficiency at that level. And so this is what the staff member or mentor or volunteer uses as they're reading one-on-one with the child. Once a student reaches a 90% proficiency at that level, they're moved to the next level. So it's kind of a fun thing. These nonfiction stories, as you're looking through them, you probably saw they're kind of interesting little facts. There's stuff about cats, and there's things about whales, and there's science and earth, things about the earth. There's just a variety of topics that really get the kids excited about reading. The cards that you have in your hand is an example of level K. So level K is equal or corresponds with a mid-level second grader. So as you were looking at that, you probably could see that was pretty simple reading, but that's what a mid-level second grader would be reading if they were on level. We love these short reads because the kids get so excited and they're not overwhelmed. When you hand a child a book and say, here, read this, and they struggle with reading, it's really hard for them, but they have these bright pictures and they get to read it and they have someone listening to them and asking them questions, which reinforces the comprehension and the things that they're trying to learn. The goal for each child is to advance 1 to 2 levels over a 6-month period. And most sites that implemented the program this school year are showing a 1 to 2 level jump within 90 days. So this is really exciting for us because we thought, oh, 6 months, it's going to take that time. And we're finding that when they consistently do this program, they've been advancing in 90 days. So hopefully we're getting those kids moving a little faster and being more excited about reading. Let's see, since we experienced this success with the reading program and plan to continue to implement it, since this was our pilot year, we plan to implement it next year because it's just doing so much good among the kids. We wanted to expand our efforts in the area of math. Now we currently do things in the area of math. We take 20 minutes per day on, we call them high yield learning activities or HYLAs. And it's easier to refer to them as HYLAs. So the HYLAs are age-appropriate math games, group work, or activities that the kids can participate in. For example, we lay out hula hoops, and the kids, we throw out a problem. Maybe it's just an addition problem, 2 plus 2. And the kids get to hop through the hula hoops towards each other, and they have to do the number of what it equals to. And they get so excited and they think it's so fun. And it's really fun for those little first graders to do that activity. But it's been a fun way to focus in the areas of math. We recognize that this is just a supplement to the school to reinforce what a child is learning in school, and doesn't really dive into that consistent practice of concepts that may be difficult for the student, where they need to practice. We've developed partnerships with our individual schools to align our math programs, or our math homework help program, and efforts with the school day. For example, Goshen Elementary is piloting the I Ready Math program. And this is really exciting because they haven't had a consistent program that provides them with data tracking on how a student is doing. And when I met with the principal last week, she said, you know, we're really excited about this. And we know you want to beef up your efforts in math. We are going to buy the license. We'd like to extend that to you in after school. How exciting is this for us? Because now they're going to be able to track what a child is doing during the school day. And then after school, they're going to be able to show, well, this is what the child's doing in after school. And we can track how after school is having an effect on the child and how they're increasing in their math. And this is really exciting for us, and it's a great opportunity because it allows the child to have a level set during the school day and then to receive that extra help that they need during after school. This is just one example of our partnership with the school. Forming these types of partnerships and developing positive experiences in core subjects will increase student proficiency in reading and math and will help students to perform better in school and hopefully in life.
How do kids become enrolled? Is it just anybody becomes enrolled, or you reach out to the families and say, hey, do you want your child to stay after for a little bit more help?
That's a great question. So we do it based on referrals from the school teachers and the principal, and then we have open enrollment for the additional kids to be able to come. But we do take the referrals, especially just because we know that those are the ones that need it most.
In here it says you're funding, there's 3 sites. Where are those 3 sites located?
So we would like to be at Goshen Elementary. We're really excited about working with them. This is our first, we just finished our first year and moving into our second year. And the Provo Clubhouse, because we have 5 schools that feed into the Provo Clubhouse. And then we're looking at Geneva Elementary and Orem, which is one of our schools that we've been at for 6 years now, I believe, 5 or 6 years.
Okay, any further questions? Thank you, really appreciate it.
All right, thanks.
The extra.
Okay, that's it.
sticks.
See, cause like, but I really think preventative stuff like this
Yeah.
is such a big deal in the community.
It is, it's just, housing is so hot because it's such a great need right now.
But nobody's really talking about it
Yeah,
here.
because none of them do housing. That's the, you know, I mean, they do like.
As far as they have the same stupid policies that Provo do that really drive up the cost of housing.
No, we don't really, I mean, zoning and stuff, we're working through that and changing that, but.
You know about Provo and 3 singles, what they've done? Because I do luxury vacation rentals and I'm legal. I've been doing it for 11 years, and Airbnb is crazy because since they've criminalized renting to more than 3 singles, landlords are just converting their houses to Airbnb.
A lot of that. And ours is 3 unrelated parties.
Yeah, but
Living there.
Provo has criminalized it, so now it's easier to do Airbnb, which is also illegal, but you don't, Provo doesn't go after it.
Well, ours isn't criminal, it's,
I know.
it's, you know, ticket, yeah.
Well, with Provo, they've made it criminal, and so now people have to go for Airbnb.
Here, thank you for coming. So, we give you about 12 minutes or so. We give you 6 or so minutes for your presentation and then the remainder for questions and answers. So, kind of yours.
Well, thank you for having me, and you've all heard, I apologize, I've been in the ERs for the last 6 hours, so, with my son, and, so I'm here and I'm.
Is he okay?
He is going to be fine. He broke his arm, both bones completely offset. It's kind of an ugly mess. He'll have surgery Thursday, which is why I came tonight, because I will be prepping him Wednesday night for surgery, and I might be just as bad then, so. My husband's home and my mom's home with him, and he's doing just fine. Everyone's kind of spoiling him, and he's good. He'll be fine. And they say he may even have his cast off by the time soccer season starts on Sunday. So life is fine. That's what's important when you're 9. I am Shauna Brown with Project Read, and first I just want to thank you all for being here and for your time spent on this committee. A lot of you are new this year. It's a different committee, and that's fun. So. Just a little overview of what we do. We are an adult literacy program, and I think people are often surprised to learn that we have almost 30,000 adults in Utah County who can't read and write at the very basic level. We're talking they can't fill out a job application, they can't read a bedtime story to their children, they can't read health information, or just it affects so many aspects of their life. And so we provide one-on-one tutoring for functionally illiterate adults in Utah County each year, and we change lives through literacy by empowering individuals, strengthening families, and building communities. Empowering individuals, I think there's a myth often that illiterate adults are lazy or stupid, and I would love to say that it could not be further from the truth. I want to tell you briefly about Bruce, who came to our program in his 60s. Actually, it had been told all of his life that he was dumb and that he couldn't do it. He's a native English speaker. He graduated from high school here. And he is in my office hours every day, and he is so dedicated and so motivated to improving his life, and he's been able to get a new job and get a raise, and he doesn't have a young family at home anymore, but just better support himself and not be on public assistance, which I think is so important. The second one, strengthening families. I want to tell you about my student. I actually started at Project Read as a volunteer tutor. That's how I got involved in Project Read. And my student was Patricia. She was a single mom. She had 2 young girls, ages 4 and 7. She couldn't read, and she said, I want to provide a better life for these girls. Fast forward it'll be 20 years in May. Both of her girls are college graduates. She just had her 2nd grandbaby, and I guarantee you that both of her grandbabies will know how to read and know the value and importance of education because their grandma found that was really important. And finally, building community. I think we believe that everyone in Utah County can read, and it's just not the case. We have so many people, and they don't walk around. They probably don't wander around the library, but I don't think you could walk down the street and point to someone and say, Kenneth, she can't read, or, you couldn't walk down the street and identify them. They don't wear a sign, they don't have a scarlet A on them, but they're your neighbors and they're your friends. I just recently moved out of a suburban, middle-class neighborhood in Saratoga Springs, and I had 3 adult neighbors within a 3-block radius of me who were not able to read. And my husband kind of made a comment once, "Hey, did you know?" And I'm like, "Oh yeah, I knew," but they don't talk about it. It's not something they share. And so we use a lot of volunteers. Last year we had 155 volunteers who gave about 3,000 hours of service in our program. And all of our one-on-one tutors are volunteer, but then we also provide literacy specialists and mentoring and labs. And so what I've come to you today to ask for is funding to specifically help with some online training for our tutors. We'd like to create an online training component. It's really hard to get these volunteer tutors who are often like college students or community members to come and spend 12 to 16 hours in a training class. And so we've tried to break it up into different pieces, but we really feel like if we can add some online components and modules to that, that it would really be a benefit to our ability to better train and keep our tutors up to date on the most current literacy, pedagogy, that sort of thing. That would be really, really important for them. The second thing that we'd like to add is specifically for our students is a reading club and a reading contest. And this is just to motivate. You know, one of the big secrets about reading is, yes, we teach phonics and we teach vocabulary and we teach reading comprehension and we teach writing, but one of the biggest indicators of their success in reading is how much they're reading. And so we feel like if we can add some additional incentives and motivations to get them reading and have some prizes, have some, you know, book club sets where they're all reading the same book and talking about that, kind of like, I don't know if you're familiar with the National Endowment for the Arts, they do a big read program where they have community reads programs, that sort of thing, where they're all reading the same books and they're talking about them and they're discussing them, and they're books that their peers are reading or that people maybe outside the literacy program might have read. I like to get easy reader books of even classics like Dr. Jekyll and Mr. Hyde or Dracula, things that other people have read and that they can talk about and feel like they're still involved with that. And then of course it will continue to help support, just the hallmark of our program is just supporting our literacy lab and doing the testing and working on specific goal, particularly focused on employment education and focused on post-secondary. And this year we really want to focus on credentialing. That is maybe not through a university, because most of my students aren't ready for a university, but they can get first aid certification, they can get CPR certification, they can get food handler's permit. There are a lot of different certifications they can have that will improve their employment opportunities that may not be through a traditional university setting as you might think about that. In the last year, with the funding that we received from you, we have been adding a health literacy and a digital literacy component, which have been amazing for our students. Last year alone, the United States was estimated to spend $235 billion on healthcare because of illiteracy factors. I was in the ER today, actually, and the woman in front of me in the ER had a daughter who had a fever, and she was using the ER as her method of taking care of that fever. And I thought, that's just a lack of education right there. You know, knowing that you could go to a primary care physician or an Instacare, and I don't know what options she had available to her, but you know, we see that where they go in and do things in those health settings that could maybe be done a little bit better. And the other biggest factor for health literacy is chronic care. And we see a lot of students who have health problems like diabetes and other things that just aren't being managed well because they go to the doctor's office and they hand them a pamphlet that's written at a 10th grade level or a high school level and they can't read it. And so helping them work through some of that information has been really, really important. And then on the other side, digital literacy. I had a group come in today that wanted to survey some of my students, and they had a 40-question Qualtrics survey on the computer. And I was like, never gonna happen. You're never gonna get any responses because one, it's 40 questions and they're really long questions, like, I don't know, they were long and crazy, but I said, plus you're adding this whole digital literacy component. They're not gonna check an email and click on it and answer those questions. And so this digital literacy has been huge, teaching them what is a mouse? How do you use it? How do you double click? It starts really as basic as that for our students. So what questions do you have for me about the program?
As far as the use of technology, do you ever use it when they're in their home and you're talking to them via the internet, or is it mostly hands-on experience? I'm just wondering how much technology you have available to them.
Mostly it is in our office. I have had in the past couple of years, a couple of students who have tried like some Skype type sessions and online virtual learning, but most of them don't have access to that in their homes at this point. They are using it in our office or in a library setting where they can get like a computer lab availability. But they can use the computers in our office during any of our office hours. Like it doesn't have to be during a specific instruction, like during a literacy lab or during their tutoring session or something like that. So a lot of them do come in and utilize it outside of those specific learning hours.
How do people find you?
Oh my gosh, that's such a good question. I put up a billboard on I-15 that says, "Can't read? Please call." No, I'm just kidding. Not my most effective tool, but we find that people who struggle with literacy don't just struggle with literacy. They're at Department of Workforce Services because they don't have a job. They're at the Community Action Services and the Food Bank because they need help with food or the HEAT program or something like that. So we try to coordinate with a lot of the caseworkers in those various programs. I go in regularly to staff meetings and do presentations about the signs of illiteracy, and if you have a client who comes in doing these sorts of things, that you could potentially refer them to our services. And that actually works a lot better for us too. They're often very embarrassed about coming into our office, but if they can get a referral from someone who they know and trust, and even if that person makes a call with them to schedule that first appointment, it makes it a little bit smoother and easier for them. So most of it's word of mouth and through caseworkers and other agencies. But if anyone wants to fund my billboard.
Okay, any more questions? Okay, thank you very much for coming in tonight.
Thank you for having me. I'm gonna go back and check on my sundown. Did I pass out enough flyers? Did they?
This direction, so they
Oh, they just didn't make it, but they had enough? Okay. It's okay, I just wanted to make sure everyone got one.
But a second,
Kenneth can just pretend she doesn't know about it. Thank you.
Good luck.
Have a good evening, thank you.
Are we ready for the next one?
Perfect one to share a smile.
Right, this is Heather with Share a Smile. Hello.
Okay, you're gonna flash those time card things down here, right?
Yeah, so
Awesome.
we give you 12 minutes. 6 minutes, you give your presentation, 6 minutes, she flashes, time for questions, approximately then, and you field questions and
Okay,
give us all the answers.
sounds great. Bring it. Awesome. Awesome. Okay. My name is Heather Hogue. I am the Executive Director of Share a Smile. We're a small nonprofit that provides free dental care for people in poverty in Utah County. So all of our patients that we see are seen for free in our clinic, and they're all under the federal poverty line. So we work with the poorest of the poor. And the goal of our program is to provide restorations and restorative smiles, particularly for people that are looking at re-entering the workforce, or people that are sort of looking to re-enter normal life after being in some kind of a poverty situation with barriers that they struggle to address. So I've prepared a little slideshow for you. One of the things unique about our organization is that we run with a crazy low overhead every year. Our cash budget every year is teensy. And that's because we run with the goodwill of dentists, dental hygienists, and assistants that come in and donate their time. None of our dental professionals are paid. So here you see Dr. Merkley. He's one of our regular volunteers with a refugee family that we worked with. We had a lot of fun with hand glove balloon things that day, but it was a great event. But he volunteers with us regularly every Friday morning, and last year he donated by himself about $100,000 of free dental care through Share a Smile. He's kind of wonderful. He practices here in Provo. It was founded originally by local dentists that were going off on these humanitarian trips every year, and they kind of got together and they're like, hey, you know, we probably have need right here in our community. And so a group of these local dentists got together and said, how can we provide quality dental care to people right here in our community, rather than always going off to Honduras, or we're always going to Peru or going to China. And from there, we've grown quite a bit. When we first initially started, we were doing basic fillings and some extractions. And now, probably the major procedure that we do is crowns, actually. We do a lot of crowns and partials and dentures and root canals and all kinds of stuff. But it was founded as a way to provide fully restorative care rather than the way that charity clinics usually operate, which is to get people out of pain and sort of send them on their way. That's a starting point for us, and the end game for us is for people to be able to have the confidence to smile and have a fully restored smile so that they can present their authentic self to the world. Statistics, in a given year we see between 500 and 800 patients, and we donate between $250,000 and $400,000 of market value dental services for free, all for the poor. Another unique thing about our program is that while we don't charge for any dental work, each of our patients perform 4 hours of community service at a cause that they care about in order to earn the visits that they come in for. I love this model because it really diminishes the sense of entitlement that you can get with charity programs sometimes. Our patients are proud of the work that they get because they worked their butts off to get it. This picture is a woman that she made baby blankets to send out. These went to the Children's Hospital and the Center for Women and Children in Crisis. And they're, as you can tell, they're lovely. I've got a guy right now that's volunteering his time at a bird of prey rehab center, which is just the coolest thing ever. I love seeing the pictures he sends me of like him working with these wounded hawks and stuff. But we do ask our patients to pick something that they care about, and then they pay for the services they get with the currency they have, which is their time and their passion. Restorative care is very important when we're looking at how you present to the world. Susan, we worked with years and years ago, and I remember her telling me about her work, how crazy it was to learn how to be attractive again. That she said it was ridiculous that she had to learn how to be attractive because people would hit on her, ask her out on a date. Like her life changed completely from picture A to picture B. This is a patient that we did this last year. Her teeth were gone mostly due to neglect. And then we did a full set of dentures for her this last year that you can see the difference. I love this guy, he's great. He said he went from grumpy old man to back to an executive type, and it kind of did. But he's not really grumpy, he's the sweetest guy. All of the dental professionals that we work with are volunteers. We work with UVU Dental Hygiene, we also work with University of Utah Dental School. And our patients are just wonderful. They're kind and they're caring, and we do a lot of good work for them. Our project request, we've requested half of the funding. We've requested for $15,000. As I mentioned, we're a small organization. We run with a tiny cash overhead budget. Half of this will go to dental supplies that we need to purchase. There are a lot of things that we can get donated. About 90% of our stuff I can get donated. What I can't get donated is needles. I can't get donated anesthetic. I can't get donated some of the popular shade of filling. I can't get donated some of the popular shade of ceramic for crowns. There's a lot of things in the dental world that require a dental license just to purchase. And so those are things that our organization pays for out of pocket. And so half of our request is for these needed supplies that are going to touch every single patient that we see. And half of our request is for funding to help us with our dentures and partials. We had a funding source until the last 2 years that paid for most of our dentures and partials every year, and then the foundation went a different direction. They didn't provide funding for those denture and partials anymore. So we've been without that for the last 2 years, which has been a little bit of a strain on our budget. That's another thing that we can't get completely donated. That the labs that we work with donate all of their time, all of their shipping, and we pay for just the cost of the dentures. So an $1,850 dental plate we can get for about $200 because it's basically just the material. So when it comes to stretching every dollar, we're really, really good at that because we stretch every dollar. And then, like I said, the other half, that's my inbox. It's always fun when I have dentures in my inbox. But the denture plates that we do are designed to last for 30 years, so they're not plastic ones that are going to crumble in 5 years. With our patient pool, we know that they're probably not going to have an opportunity like this again, and so we try to set them up for life and work with them as long as they're in the area. So thank you. If you have questions, that's me with a really cute little refugee girl. It was amazing, but I'm open for questions.
I would say, if I could summarize this, maybe tell me if this is accurate, because you have now,
right?
And you would say they're more just take care of the pain. You go a step further. You improve quality of life.
Our program is a program rather than a clinic. So we anticipate people being in our program for a significant amount of time to complete all of their dental work. They're working poor, and so the intention for us is that they receive the same quality of dental care that I would receive if I went to my dental provider. There's definitely a place and a need in our community for emergency care. Not dissing that in any way, shape, or form, but our program goes a little bit further than most charity clinics in that we focus on the restorative.
So I have a question.
Yes.
You have other funds, private and other, of 2,500.
Correct.
Which makes your total 17,500.
Mm-hmm.
Servicing about 500 people, that's $30 to $35 per person. But you said 90% is donated. What would the dollar equipment and
oh gosh.
So I mean, does that change it? Your numbers look rather low as far as other contributions. What would you say you're donated? Or
our in-kind material donations fluctuate between $5,000 and $10,000 every year of in-kind materials. And then our in-kind services are all of that, the $300,000, $400,000 of dental care that we're providing. So for example, Dr. Merkley that I told you about donated over $100,000 of free care market value last year. So that's an in-kind services donation. But Patterson Dental and Henry Schein 1 donate things like gloves and gauze and like things that we need that we don't have to purchase. So that vacillates every year between $5,000 and $10,000 of in-kind supplies. Sometimes we get random curing lights donated, or it just depends on what people have that they want to give us. Somebody gave us a broken canogram machine last year, so I mean it just depends on what they want to give us.
I have a question. So are you a clinic that they come to you, or you're a service that connects the providers with the clinics?
We are a clinic. Mm-hmm.
Okay, so this is an actual physical location. You work with that dentist?
We work with many dentists that come in and volunteer.
But they come to your clinic?
They come to our clinic. So we provide the assistants, we provide the patients, we provide the Dentrix software that tracks everything, x-rays, and all of the supplies, so that the dentists don't have to do anything out of pocket, but show up and do good work.
Do the work, got it.
And then Henry Schein donates the space,
They donate the space, so we don't pay rent, we don't pay light bills. Every penny of our ask is going to direct patient care.
So you're coordinating the doctors to come in, run full shifts, that kind of stuff?
Yes. Yeah. Yeah. We operate right now Tuesday, Thursdays, and Fridays in the clinic in American Fork.
So how do patients know about you?
We are a referral-based program, so we have 16 clinics, or 16 programs in Utah County that refer patients directly to us. I reach out to the case managers at each of these agencies working with poverty. They give me a list of patients they've screened for eligibility and that they feel like will actually make a difference. I could get 100 calls a week of people looking for dental services, but I don't know who's really in need, who's looking for, something quick. I don't know that because they're strangers to me. But if I contact Wasatch Mental Health, for example, and say, give me your next 10 people that are going to follow through and who this is really going to make a difference for, then we're going with their boots on the ground approach of who is most in need, who's going to follow through, and I don't have to guess, who's really in need and who's going to make it to appointments. And that gives us a little bit of help. This population's tough. I mean, it gives us a little help because I can call a caseworker and say, hey, John Doe's got an appointment on Thursday. Do you know if he's got transportation? Or Jane's got an extraction on Friday. Would you make sure that she has somebody to drive her home? So working with all of these agencies that are already working in poverty and just piggybacking on the good work that they do helps us, again, keep our overhead super low and make sure that we're not stepping on any toes and we're taking the people most in need.
So are your patients not eligible for Medicaid, or do you provide services beyond what that would cover?
We provide services beyond what they cover, but most of our patients are not eligible for Medicaid.
Okay.
We are working on a contract with U of U to do some Medicaid, but that's still in flux. And what that would look like is mostly seniors and also people exiting from a substance abuse treatment program. So, but 95% of our patients are not Medicaid eligible, even with the recent expansion.
Okay, any further questions? Okay.
Okay.
We really appreciate you coming tonight.
Thanks. I like your signs. That's great. I'm gonna incorporate that into my meeting. Thanks a lot.
The last applicant of the night, he's still working on, what, still working on scoring. Just head over, take it this way.
Yep, once you're done scoring. So I'll get these inputted tomorrow, and then we'll meet again on Wednesday, so we'll have the scores entered. Wednesday I'll score as we go so that we can look at where everything lands by the end of the night.
And Wednesday would be a little bit lighter night. We still have quite a few presentations, but we anticipate that the last portion will be discussing recommendation for funding. Does anybody have any questions?
That's a good program.
Yeah. Thank you so much for your time.
Stop recording. Yeah. I'll remind you when to stop.
How many of you will
I guess
make
not.
sure that you look back?
I'm gonna give you mine.
Yeah, leave it on the table.
You can take them if you promise to bring them back.
I don't want to.
Remember that if you do want to look at the applications, you have access online.